Okay, here now we go to content 3, which is 8%, so nervous system pathology. Okay, so we're looking at abnormal functions, including structural, biochemical, or neuropsychophysiological abnormalities, congenital, and their impact on body systems. Okay. First one is ecological factors in the diagnosis of dementia, delirium, and other cognitive symptoms or disorders. So the symptoms of dementia include agnosia, memory impairment, dysphagia, poor executive function, poor self-control, poor judgment, fluctuating level of consciousness, rapid onset of symptoms. What would this be? What would you call that? C, more likely to be. Late day confusion, fluctuating level of consciousness, though, would reflect delirium. Thank you. Jessica got it, and James got it, Pet4 got it. Okay. So we know the answer to this, right? It's D. That's pretty simple. How do we define mild cognitive impairment? I wonder if that's going to come up because that's a new entity out there now. That might come up. How would you define it? What's mild cognitive impairment mean? Okay, to have dementia, how many areas have to be impaired? Several. Memory plus something else. That's it. Memory plus something else. Okay, it's just really 2. Can dementia be static, or do we always assume it's progressive? It can be static. That's right. It doesn't always have to be progressive. Right, exactly. Dementia due to head trauma is largely static. That's correct. TBIs would be a great example of that. Or somebody who had a brain tumor that was removed and they had to excise a large chunk of brain. That would be fairly static. Okay, symptoms of Lewy bodies dementia. What's the hallmark for Lewy bodies? I think we said it once before. Okay, it's a mixed. There has to be some Parkinson's symptoms, and it's almost always associated with hallucinations. But there has to be some Parkinson's component with the dementia. So they have here hallucinations, memory, cognitive deficits, Parkinson's-like movement symptoms, and REM disorder in which dreams are acted out. Okay, and it's D. Ray's syndrome is associated with the use of aspirin during chickenpox exposure, encephalopathy, brain damage, liver damage, all of the above. Should be E, A, B, C, D, E, even though it's not posted here. Oops. So etiological factors in the diagnosis, still we have this dementia. No, we already talked about that one, I'm sorry. Okay. Dementia from urinary tract infection or from hepatic encephalopathy has in common a buildup of ammonia. Okay. Symptoms of delirium are characterized by acute confusional state. Okay, cortical dementias include all of the above, except which one? B, Huntington's. Where's the pathology? Basal ganglia, particularly the caudate. Okay? Everybody got that? Subcortical dimensions include all but Lewy bodies. See, we're almost done with this section. Cortical dimensions include all but Parkinson's. Which condition affects the frontal temporal areas by accumulating tau proteins in aggregates and results in dementia? That's Pick's disease. Are any of you Jakob-Crutchfield's dementia? Have you ever seen any patient like that? Any of you? Nope. No one. Tony, no. Peter, did you get a chance to examine the patient? Not really. Okay. They have a startle response that's pretty amazing. If you clap your hands behind them, they startle. They jump quickly. You can even do it in front of them too, and they'll get the same response if they're not expecting it. Let's see. Pseudodementia represents what? Most likely precipitous, right? You wouldn't say it's levels of anxiety. You'd be more likely to say depression. You could have just thought through that, right? You wouldn't even have to know that as a fact. And now this is another category. Ideological factors in the diagnosis of chronic pain, including headache, migrainous versus non-migrainous headaches, disc compression, which would be like radiating neck pain, and neuropathic pain. Everybody knows what neuropathic pain is, right? Burning, numbness, kind of a shooting type of a pain, right? Okay, and somebody's already answering the question. Which headache is more common in women, more reactive to the stages of the menstrual cycle, tends to occur in the morning, and is clearly relieved during pregnancy? And the answer is B, migraine headaches. Okay, what is the cause of headache that occurs abruptly without previous history of headache while engaged in a strenuous exercise? Subarachnoid hemorrhage is the proper answer. Benign tumors rarely create headaches because they grow so slowly. Pain that is diffuse, migrates with time, and does not follow an anatomic pattern is likely to reflect. Is it likely to have been depression, anxiety, and most probably vascular, both A and C and B and C? And so the answer becomes A. Etiological factors in the diagnosis of sleep disorders in elderly. And this is sleep latency is reduced, REM sleep duration is reduced, frequency of REM occurrence is increased, stage 4 sleep is non-existent in both B and C. And so the answer is B, it's REM sleep duration is reduced. There is a chapter in there on sleep, so you want to check that out. In childhood, boys experience more nocturnal enuresis than girls. This is in childhood. Girls experience more sleepwalking than boys. Boys experience more night terrors than girls. There are no gender differences in sleep disorders, and the answer is A and C. Boys experience more nocturnal enuresis than girls, and girls, in turn, and boys experience more night terrors than girls. So we pee on ourselves when we're trying to sleep, when we have these terrible nightmares. Ha ha ha. Okay. Knowledge of ecological factors in the diagnosis of sleep. What are sleep waking, walking occurs, what stage of sleep this is. It's D. It's level 3 through 4. That's pretty simple. Yep, poor boys, right, Heather? You got it. Yeah. Night terrors. So what stage of sleep is night terrors? And it's the 3-4. Depression, what does it do to our sleep? Shortens REM latency, increases REM sleep, decreases slow wave sleep. A and B are all of the above. That's all of the above. So it shortens REM, increases REM sleep, the REM latency, but increased REM sleep, and decreases slow wave sleep. We'll never forget that one now. Now this is a new category, etiological factors and diagnosis of movement disorders, including Parkinson and Huntington's and Tourette syndromes. Huntington's, a chromosome 4 autosomal dominant disorder, is characterized by what? C, depletion of GABA. And this one is etiological factors and diagnosis of movement disorders. Here we got Parkinson's, Huntington's, and Tourette's. Alzheimer's dementia is associated with which of the following genes? All of the above. So beta amyloid precursor protein gene APP on chromosome 21, presenilin 1 on PS1 gene on chromosome 14, and then presilin 2, which is gene on chromosome 1. So all three of those. What condition is best described by bradykinesia, Lewy bodies in the substantia nigra, and dopamine deficiency? This should just pop right out. Everybody should be able to get that, right? All right. Which neurodegenerative disease usually attacks both upper and lower motor neurons and causes degeneration throughout the brain and spinal cord? ALS. Any of you treated anybody with ALS and followed them? Yeah, James, Peter, okay. Just lost a friend 4 months ago. Sorry to hear that. It's a terrible disease. The answer says B, not B. It says B on mine. Oops. Okay. Yeah. I have one patient right now who, very nice lady, whose father, she nursed her father to the death, his death, and was there to witness everything that ever happened to him. Unfortunately, she now has the disease, and she's gradually going down as a result. It's real sad. Sweet person. You know, you can be good and still suffer something bad. You know, life isn't always fair. So what do we got here? Which genetically transmitted tic disorder, with its parents having 50% chance of passing the gene on to their children? Girls with the gene have a 70% chance of displaying symptoms. Boys with the gene have a 99% chance of displaying symptoms. Is believed to be caused by dopamine excess or supersensitivity of the postsynaptic dopamine receptors. So I think we know that's Tourette's, right, guys? Everybody got that. Let's see, knowledge about etiological factors is still Parkinson's, Huntington's, Tourette's. Alrighty, the question is which condition is the result of immune response to foreign antigens such as infectious agents or vaccines, and is manifested in acute polyradiculopathy affecting the peripheral nervous system? Guillain-Barré. That's the giveaway. All the rest is just sort of clouding the polyradiculopathy. Oops. For some reason, it wants to click back. There we go. Down syndrome involves which of the following genetic factors? The answer is D, trisotomy on chromosome 21. And you get all of this in that chapter on the genetics, for all the major disorders that they have. Mental retardation is not associated with which of the following? Williams syndrome, Wilson's disease, Ray's syndrome, Fragile X, and PKU. It's Wilson's. Remember, that's the copper metabolism. Just by knowing that, you could have answered that correctly. Remember, somebody mentioned, we talked about Wilson's before. Okay. Which is the most inherited cause of mental retardation? A condition marked by physical attributes that include long face and pronounced ears and jaw. Okay. So in this case, it's Fragile X. And Fragile X syndrome is a genetic disorder affecting X chromosome, the result of substance abuse by the mother during gestation, a mutation of the FMR1 gene associated with superior intelligence. It's both A and C, mutation of the gene and genetic disorder affected by the X chromosome. Okay. From most to least, which conditions are the greatest inheritability? Schizophrenia, obsessive compulsive, followed by alcohol dependency, followed by major depression. So we don't need to go any further. That's just what it is. It's A. Schizophrenia first, obsessive compulsive next, alcohol, and then major depression. Which does not belong in the autism spectrum disorders. Rett, Asperger's, pervasive developmental, non-specific speech delay, and childhood integrative disorder. It's supposed to be D. Yeah. What percentage of children with autism are mentally retarded? It says D, greater than 75%. They still diagnose childhood disintegration disorder, do they? I don't know. I don't see those children, so I can't answer that. Anybody know the answer to that question? It's a good question, though. No? Okay. Oh, Tony, I think that it has gone out of the DSM-5 anyway. Yeah, I'm certain of that. Yeah, I've heard that. But I don't know if anybody's still using it at this point. That's why it's hard for some people to believe after seeing. Oh, MR used to be 80% in autism, but pediatrics had an article that said otherwise, with 6 pathways. Oh, wow. Fetal alcohol syndrome presents with all of the following, but poor memory, attentional deficit, compulsive behavior, poor cause, effect reasoning. So it's E. Right. Got that one. Uh-oh. So these are the vascular disorders. Short-lived general inability to learn new material due to retrograde and anterograde amnesia is indicative of a TIA in the posterior cerebral artery. Why would it be in the posterior? What does the posterior feed? Any clue that would tell you that? Why there's so much memory loss? Hippocampus, right, James. That's right. Because it feeds into the inferior part of the temporal lobe where the hippocampus is. In the temporal region, that's right. But not the cortex above, not the temporal cortex above. Okay. Occipital headache, gait ataxia, lethargy, and dysarthria are typical disorders of so the answer here is D. How long does a TIA last? What's the rule of thumb? Minutes, but it can be longer than minutes, right? It's relatively brief, but it has to be less than 24 hours. Can be seconds. More commonly, it's minutes, sometimes even an hour or so. Is that a benign event? No, it's not. No. What's likely to happen if they don't take heed to this warning? They're probably going to have a stroke. No, it's prodromal, major stroke, yeah. They're not going to have a medical emergency until they have a stroke, but they're likely to have a stroke, but it may not happen for a while. Okay, status epilepticus is a generalized seizure, out of control though, right? Has to be continuous. So it's D. A typical antipsychotic is most likely to cause seizures is, and drum roll everybody, clozapine. Okay. Partial complex seizures are likely to derive from the temporal lobe. Post-traumatic injury, head injury is associated with seizures. Seizures may become manifest with a lag time from the insult. Closed head injury reduces the incidence of seizures. Amnesia is generally seen in severe closed head injury, all of the above. Okay, that's the answer. Okay, tell me which part's not making sense to you. Okay, the answer is all of the above, right? Yeah. Don't understand C. Good eye, because I'm looking at that too. I'm going, okay, let me see if I can wrap my head around why this is correct, okay? If you said open head injury reduces the incidence of seizure, you would absolutely say what to that? You'd say that would be false, right? So technically, the way I think they're phrasing this, they mean to say that if compared to a closed head and compared to an open head injury, that the likelihood of a closed head injury causing a seizure is less likely, is what they need to. That it's just a bad stem, but I understand, and they are confabulating this. Yeah. What's a post-traumatic, where are you reading post-traumatic head injury? What is a post-traumatic head injury? after the head injury? Where's post-traumatic head injury? Oh yeah, the very top. Post-traumatic head injury is associated. This is after the traumatic head injury. It's associated with seizures. Seizures can become manifest with a lag time from the insult. Okay. But it's just it just needs to be rewritten. It's a bad question. Okay. So this is still more trauma, personality change following a traumatic brain injury. It's most likely to be with injury to what? Your first response would be likely to be injury to the frontal lobes, right? Everybody knows about that. But the answer is E, because you can get similar problems with temporal lobe injuries. But not as bad. So that's a little bit of, that's one of those ones that I would be a little iffy on. I think my first response, like yours, would have been frontal lobes. Okay, no, we're still doing post-traumatic stuff. Symptoms of mild traumatic brain injury. Everybody, well, not everybody, but most of you should know this one. You get headache, dizziness, vomiting, and some nausea. The key here is mild trauma. If you have an unequal pupil size, that's not a mild trauma. If you have a seizure, that's not a mild trauma. So A becomes the answer. Right. So we go neurobehavioral psychological disorders that have an hypothesized neuropathological basis: schizophrenia, affective disorders, anxiety, ADHD. So gender differences in onset and prognosis of schizophrenia include males develop schizophrenia earlier and males have a poor prognosis with schizophrenia. We're in trouble, guys. I'm telling you, we're going to beat up bad here. That's the answer, bad boys. Bad day for boys, that's right. That's the answer. And we get to die earlier, too. Yippee. What percentage chance is there for a second monozygotic twin to manifest schizophrenia once his or her twin sibling has shown schizophrenic symptoms? It's very high. It's B, 50. 75 might be a little bit high, so that's why I would have picked 50. I know it's greater than 25. What portion of patients with obsessive compulsive disorder will at some time have a major depressive episode? That's true. I don't get migraines. The answer is C, 3/4. Okay, so all right, then we get some more. It's the same sort of stuff. Okay, which disorder has the highest incidence of occurring in first-degree patients of a patient diagnosed with the Kane disorder? There's obviously something missing here. That has to be redone. Same disorder. There you go. Okay. So it's bipolarity. Which disorder has the highest incidence of occurring in first-degree patients of a patient diagnosed with the same disorder? Bipolar. Okay. This keeps going on with all this stuff. Serotonin hypothesis of major depression is what? Explains all aspects of depression. No, does not explain the lag time and the effectiveness of SSRIs. That's true. Okay, has been expanded to include a cascade of biochemical events, including gene expression triggered by 5-HT. That's true. Is currently in disrepute. No, it's E. All of the following have been hypothesized to play a role in panic, except, oh, here's that kind of thing we just talked about earlier today. Okay, hypothyroid rebound. false suffocation alarm. I don't know what that is. Being held down, like having a pillow put over your head and not completely suffocating, but you have a panic episode or something. That's been hypothesized to play a role. Learned. When you're not, yeah. Okay. ADHD is considered to be a dysregulation of both A and B, norepinephrine and dopamine, largely based on that's what the medications do. I guess it's okay if we skip some of these things. Let's see. The common psychiatric manifestation of neurosyphilis includes what? Psychoses, mania, depression, dementia, C and D. All of the above. It's going to be depression and dementia. Okay, which autoimmune condition, you don't have to go any further with this one. Once you see oligodendrocytes, what are you going to think of? You're going to have to think of something like multiple sclerosis. See if there's anything else. Okay. EEG shows a normal background, so this is a different category, knowledge of basic neurodiagnostic markers of neurobehavioral disorders found on EEGs and diagnostic imaging and neuropsychological assessments. EEG shows a normal background in 3 Hertz generalized spike and wave discharges. So what do we got there? Absence. Always remember that 3 Hertz generalized spike and wave pattern tells you that you have absence. Seizures. This thing's skipping again. Knowledge of basic neurodiagnostic markers, that's the same thing. Mild mental retardation, we know what that is, okay, so we don't need to go any further with that. It's a silly question. Alzheimer's is characterized by plaques and tangles, we know that, right? Everybody probably knows that. Demyelinization, multiple cerebral infarcts, MRI evidence of ventricular hyperintensities. So the answer is E, both A and D. Which of the following conditions are not extrapyramidal? And that's a good question for you. Yeah, C, right? Because when we say extrapyramidal, what does extrapyramidal mean, actually? I know some of you know this, so. Out of the pyramidal tracts, yes, that's right, out of the pyramidal tracts of the brain. So other aspects of movement. Let's see. Okay, which of the following structures are not part of the extrapyramidal pathways? That should be pretty obvious, right? Everybody sees that, okay. And tardive dyskinesia differs from Tourette in the following way. Deficient dopamine versus excessive dopamine. So is this deficient dopamine versus excessive? And the answer is yes. A is the correct one. Dopamine 2 receptor blockade is responsible for what? All of the above, right? Because these are syndromes that are associated with being on these too long. All right. Now we got this physiology and pathophysiology. So this is other things outside of neurosciences. Yes. It's a movement disorder where you, it'd be easier almost to imitate it. It's like that